Hi, I'm Jason Snibbe. I'm an orthopedic surgeon here in Los Angeles. I specialize in shoulder, hip, and knee surgery. I do approximately 700 surgeries a year. Approximately 300 of them are hip replacements, 150 to 200 are knee replacements, and the rest are shoulder replacements and a little bit of hip arthroscopy. I practice in Los Angeles. I work out of two hospitals, Cedar, Sinai, and St. John's Hospital. The reduction of edema makes a significant difference in many things, but primarily is wound healing. So the more tension there is in the tissues, the more stress there is on the incision. So the incision can pull apart, can separate, can start leaking. That's a higher risk of infection. And obviously wound healing is very critical in a joint replacement because there's metal under that knee. And so infection is a very large problem. If you get an infection, it creates a big disaster in the surgery. So we really focus on reduction of edema for wound healing, for pain, and for increased function. And I think that the overall edema reduction is a significant part of improving that, and the quicker we can reduce it, the better the results of the surgery. My use of the geko device now for approximately 2 years now has been a dramatic change in the results of our surgeries. I see my patients in the hospital, then they go home for 2 weeks, and for 2 weeks they're home and they're walking and they're receiving physical therapy. When they would come in at 2 weeks, they would have significant amount of swelling in their leg, large ankles, big pitting edema in their legs. With the use of the geko device, the patients return at that 2-week mark with a significant reduction in edema. And now, for the first time with the geko device, we've seen patients come with almost negligible edema. And that has been a big shift in what we've seen in the past. The beauty of the geko device, which I love, is the simplicity of it. It's such a simple, elegant device. And I think that increased circulation is a critical part of the geko device because it's not just DVT prophylaxis, it's also increasing circulation, which is critical for wound healing, for improving the function of the limb. And I think that is a critical part that I think clinicians need to understand. And in my practice, all surgeries, lower extremity surgeries that I do, so any hip or knee surgery that I do, any ankle surgery like an Achilles tendon repair, will use the geko device. I also use the device in any type of issues with swelling. So anyone that has even a non-surgical issue, like they sprain an ankle or they tear their medial ligament in their knee, any non-surgical injury, we use the geko to decrease edema and improve their function.